What can you expect when you come in for a first consultation and treatment? When you first come in for an appointment here, we take a thorough medical history. We need to know about the symptoms that have brought you in for treatment, but we also need to know about all your medical history, because there may be factors there that are impacting on your musculoskeletal system, and we need to know about them. We always need to know if the condition that you're bringing in is something for us to treat. Sometimes people may come in, doesn't happen very often, but sometimes people come in and it's a symptom masquerading as a muscle or a joint problem, but it might be something for your doctor to see. So we need to go through a very thorough medical history. When we've been through the medical history and we've asked you lots of questions about how your pain started, what makes it better, what makes it worse, we'll ask about your sports and activities and all the sorts of things you do in your occupation and workstation. Then we start to go through an examination, and this is normally a spinal examination to start with, where we look at your posture and we look at spinal movements, and we may look at your neck or your knees or your ankles or any other joints that may be relevant. And all the way through, we like to explain to you what's going on. It's so important to you as our patient that you learn from your experience of coming here for treatment. So when you do leave, we like you to feel that you've been well informed and that you have a better level of understanding about why you've been suffering. For a lot of people, the point at which they get better, if they've been unwell for a long time, the point at which they get better is when they start to understand and take on board why they've had pain. Then you're in a position to make choices, guided choices about how to do things differently in your life that help you to get better. Case history taking for children and young babies is somewhat different. My colleague Anya Malachinska has a postgraduate qualification in paediatric osteopathy, and she treats children and babies at the Osteopathic Centre for Children in central London. So when Anya is looking after an infant or baby, she'll obviously be talking primarily with the mother, and a lot of the history taking will be focused on what happened at the time of the baby's birth. Once we've gone through a thorough history and examination, we proceed with treatment, and we make sure all the way along that you feel comfortable. We explain all the techniques that we'd like to do and make sure that you feel okay about that. And if anything feels uncomfortable, we always encourage our patients to let us know, because that feedback's also helpful for us. We like you to find treatment as a pleasant experience. So we do explain what we're doing as we go. At the end of treatment, we normally finish with some therapeutic exercises. Very often we'll give advice about how to manage the condition. Sometimes people need to ice a sore low back, or they may need to apply heat. We give plenty of advice about that. We give advice about what to do, what not to do, postural advice, and very often we talk about workstations and give really critical advice about how you should be sitting and the sorts of things you should avoid.